Time being 6 o'clock, I will call the Board of Health meeting to order. All members are present. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. The first item on our agenda are announcements from the Health Department. So, Health Department, I will turn it over to you.
Nothing really official to announce at this time. As I mentioned last meeting, Lindsay has resigned. I am getting a lot of call about flu clinics and vaccines. We have them. We can't give them out. There's no plans on hiring a new nurse, so we are not anticipating doing flu vaccines at this time. So I've been directing people that call to Duval's and Whitman. They had sent a notification to us that they have, I think they have flu, COVID, shingles, a couple other ones are all available. The insurance will pay for them. So that seems to be the best place to go. I know it came up after the last meeting. There is some restructuring being planned. Nothing is official until the town manager says it's official. What was presented last week, my understanding is that the health department is just going to be folded into inspectional services. There'll still be a board of health, administratively me, I guess, but nothing's official until it comes from the select board or Scott. So that's that.
Okay. Do you still do the inspections for the restaurants?
Yes, I have contacted Alsco to do some of them, so that we just because I'm doing everything right now, so they'll pick up some of the slack, but it'll be a combination of both me and Alsco. Our shared services grant allows us to use a shared inspector, but they can't take the place.
Does that too, yeah.
Yeah, Avon's been using them as well, so we'll kind of split it with them.
I've been strapped for time. I wanted to do research about what other local municipalities don't have a acting public health nurse. I have written to the Board of Selectmen myself, and I, as a nurse, am very displeased with this decision, as a lot of community members that I have spoken to are. I really see it as a step backward, and I just wanted to verbally say that.
Did they respond?
Mm-hmm.
They did?
Yeah, they just said it was due to budgeting and that there was a hiring freeze right now. So I am saddened, and I hope that they change their mind.
Yep, it's challenging.
Thank you, Katie. I would definitely agree with that.
Yeah, I would echo, this is not a decision that this board has any control over or any impact on. So if anybody has any concerns with what is happening, watch your select board meetings, reach out to the town manager, have that conversation. But as much as we probably maybe agree with some of that, we want the mission of protecting public health to happen here. If that's just not the avenue that's going to be the most fruitful, and I would encourage people to go to the town manager directly. Any other questions on anything? Seeing none. Moving forward. First discussion and action item is to approve the minutes from September 8th. Do I have any action on those?
I'll make a motion to approve the minutes.
Motion to approve by Katie. Do I have a second?
I will second those.
Second from Carol. Any further discussion? All in favor?
Aye.
Aye.
Opposed? It's unanimous. They're approved. Moving forward, a board vacancy update. Some of you recall, Jason Harris resigned from the board at the end of August. The posting was made on September 8th. Per the town charter, we have individuals have 10 days to return their interest in filling that position. That did not happen in the 10-day period. So that pretty much that window ended. So for the future, I guess, I'm not sure if the select board is planning on reopening the application period or not. That is their call. I assume they would. I think in just kind of the brief chatting that I had back and forth about just process with that, if it had closed for the first period, we were considering opening it a second period, because that's just what we've done in the past. But they haven't indicated that that's what they're going to do yet, so nothing official. If that does happen and people do apply, there's a 10-day window, then the applications will close, and then the select board has, from the date of the posting, 14 to 30 days, the select board and us, that is, to fill that vacancy. So It pretty much, the whole process takes up to a month total to have happen. The goal was to be able to fill that seat tonight. Obviously, that's not the case. So I'm not saying clear all your Mondays for the next month because that's kind of ridiculous, but just be mindful if that does open up again. That starts the clock. It could be any time between then and 30 days from then that we might be asked to be part of that meeting, and a majority of us should be there to do that. So,
Make the decision.
exactly.
Absolutely.
So, any questions on that or how that works?
No, but it makes sense though that you wouldn't open that 10-day window again until there was someone who expressed interest. Otherwise, it seems like a waste of time, no?
I mean, yes, but if they express interest and they can't actually do anything until we go through this whole process. I mean, I'm not fully sure either. We've provided the notification of vacancy. Do I have to notify them again? Is that how the charter works? So there's some procedural method there that we're going to make sure gets followed. But it's a conversation with the town manager. Once something is official, that will be a forwarded email or a meeting with you guys just to let you know what's going on there.
People, come and join us.
So once that goes out, I guess keep an eye out on the town's bulletin board, which I think is just the front door, if I'm not mistaken, and it should be on the town website as well, if that does get posted. Okay. Any questions, comments on that? No? Health agent report, Chris?
Sure. Everybody should have a copy. I've been a little busy, so inspections are a little light. I did do the semi-annual for all 3 schools. Everything looked great. And we did receive a report of a foodborne illness complaint through Maven. Patient ate at Giardino's, had a chicken sandwich, so anytime that we get a complaint like that, we do a complaint-based inspection. I did note at the time of my inspection that the flip top by the stove, the raw chicken was being held at 53 degrees Fahrenheit, which is smack dab in the middle of the danger zone. So I had them discard it on site and put in an order to service that flip top. Whether or not that was the cause of the food poisoning is hard to say. It's definitely not a good food practice to be keeping food not at temp, but it was corrected on site. And so,
Do you mind explaining what that term Maven means?
maybe, yeah,
I
it's.
know what it means, but
Yeah, I can't remember off the top of my head what the acronym is, even though I just completed the training. But that's our infectious disease surveillance. So there are, I think, 93 reportable diseases. If somebody gets a lab result or is at the doctor's office and pops with one of those, local board of health gets notified and we do an investigation. So I'll get to the Maven training in a moment. So no fine, no priority violations this time around, other than Giardino's having food not at temp, but that was corrected on site. A couple complaints we received in the last couple of weeks. Somebody's been dumping trash near the Chestnut Glen Apartments, so please stop. Got a report of rats in an apartment building at Washington Street. I went and did an inspection today. There is an infestation. We've issued correction order for the property owner. And then I just got a call this morning. Somebody dumped 2 upright vacuum cleaners on High Street over by Gillespie Way. Again, please stop dumping your trash. And then finally for training, so going back to the Maven, that's our infectious disease tracking. Lindsay had been the person checking Maven while she was here. In towns that do not have a nurse doing it, it's the health agent. At this current moment, we are being covered by Brockton, one of the nurses there, but I just completed my training and got the credentials, so I'll work with them to get caught up to speed, and then I'll be doing the Maven tracking for Abington.
It's Massachusetts Virtual Epidemiologic Network.
Thank you. Yeah. I had a lot of information thrown at me during the training, so the
If anybody's
acronym
wondering.
was the least of my concerns.
So, any questions on the health agent report?
No, thanks for doing the training.
All right. Public comment? Anybody from the public have any comments? No? I know.
you added it and I'm not.
I that because you asked, so I put it back on. No? Any correspondence from you or the board to share?
Nope, just like I said, we're getting a lot of requests for flu vaccine because it's flu season, so please do go get your shots, but sorry that we're not able to
Before
offer.
we had Lindsay, we used to have understanding with the social visiting nurses. Is that something that we can't tap into again? They used to come do pressure screenings.
Yeah, I've had a couple of nurses offer to volunteer their services. What I'm trying to find out right now is if the vaccine we have, which was ordered under Lindsay's license, if we're able to use that or not. There's some legality tie-ups with that. And I actually am going to talk to the distributor tomorrow too. So if we can utilize it, we can probably pull in some resources.
Probably would be following up on that myself, just to make, because I know that we used to have that. They used to go down once a month and do blood pressure. I think they did something about diabetes too down at the senior center.
Yeah.
Before Lindsay, we didn't have COVID, so there wasn't anything that they ever did about COVID, but they used to do a few home visits to ward off hoarding, as that was a senior citizen concern back then. People that have been in their houses for like 40 years.
Mhm. We do have a meeting coming up with our shared services group, and one of the questions was what sort of staff we want to be hiring to share amongst the 5 communities, and I just said, so Abington is in need of some public health nursing now, so that's one thing we might be looking at too. So
I see Rockland's doing the same thing. Well, they did the same thing with Alsco too, the food inspection, but they've teamed up with Hanover.
Hanover, Pembroke, Marshfield.
Plymouth does it too.
Yeah, every single town and city in the state, with the exception of Boston, I think is in a shared services group. Boston's kind of its own thing.
Right, but it makes sense.
Yep.
Because what they do is they pair up towns with like resources, like I said the last time, Avon has all of these industries and only 5,000 residents. So when it comes down to an emergency, eminent domain comes in, and if you get all the industries and they have cases of water and you need cases of water, that's you share resources.
Mhm.
So yeah, but there's a formula that they go by. I think it's great to pair up with Brockton because they have a lot of savvy.
Mm-hmm.
Not that they want it all, but they do have it.
They get it.
Last thing I'll say, kind of correspondence, it's me corresponding with the board. Light agenda this week, back to regulations starting in October. We need to go over body art again to finally get that moving. Been waiting too long for answers, so I think we're just going to move forward, and that might get us some answers.
I'd
So,
like to finish up with the animal thing too.
yes, that as well.
Yeah.
So we'll actually, and thank you for the reminder, we'll put both on the agenda for our next meeting, continue that discussion as well. We've had vacancies, we've had other things come up that we've needed to take a break for, but let's get back onto that core mission. So
Great.
body art and animal.
Next meeting date? Yeah.
Next, it is
Are we back to
October.
the first and third Monday?
Yes, we should be back to the 1st and 3rd. It is October 6th. Monday, October 6th, 6 PM, these quarters.
And Chris, I'll look over, because I know I have some certifications. I've gotten some since Lindsay, and I don't know if you have them.
Mhm.
So I'll just make sure that you have my FEMA and MEMA thing.
Oh, awesome. Yep.
Yeah, because I think it might be helpful.
I think we have a Susan file.
Nice.
So back to 6 and 20.
Yeah, 6 and 20. It should be 1st and 3rd.
I like that.
Yeah, all good stuff, all good stuff.
Whatever floats your boat.
Yeah.
Sometimes it's good, sometimes it's bad.
I'll make a motion to adjourn, ladies and gentlemen.
Motion to adjourn by Katie. Do I have a second?
I have a second.
Second from Carol. All those in favor?
Aye.
Opposed? It is unanimous. We are adjourned.